So hello guys, I am student of second year MBBS at Jalpaiguri Medical College and Hospital. So as you know, we have bones in our first year that comprises of 4 total sets of chapters according to anatomy, that is supex, infex, and head and neck and thorax. So we, as you know, in your WBUHS we have division of these bones in axial and appendicular skeleton. In axial skeleton, we will mainly talk about the thorax and head and neck section, and in appendicular skeleton, we will talk about the supex and infex. So we will be starting with the supex and infex series in this new playlist which I will be making. So thank you for watching this video. So we will start now. See how many bones you have to study for appendicular skeleton. Now dealing with the hip bone, innominate bone or the coxal bone. So for the hip bone, first I will tell what type of bone it is. It is a flat bone, and the parts of the bone, the ilium, the ischium, ischial tuberosity, you will learn many things about this. The pubic tubercle. To put the bone in anatomical position, take between the thumb and the index finger this space. Put this in the greater sciatic foramina. This is not called foramina because it is converted to foramina. Okay, now it is not the foramina. Put this in this and then place it like this. Okay, one rule I am telling you, the examiner will not ask the anatomical position points first. First they will tell you to hold the bone in anatomical position. So first you cannot tell the points and expect the teacher that they will let you put the bone in anatomical position. If you hold the bone in wrong anatomical position, you are doomed. But that is for sure. So first see the bone, hold the bone in anatomical position, and then the anatomical points. Okay, so I am also doing the same. First, this is the right hip bone. I am holding it in my right hand. Okay, so how did I know this is the right hip bone? This is the acetabulum fossa, okay, and this is the obturator foramen. This acetabulum fossa, it forms a joint, synovial joint with the acetabular. This is head of the femur, okay. Ball and socket synovial joint, the hip joint, okay. And then this is directed laterally, and just see the ilium. Ilium is directed upward. And one more, this is for side determination. And for holding anatomical position, just take your right hand, left hand actually. This is right bone, so I have to hold it with my right hand. Take the left hand, put it in the same coronal plane. Okay, so this is the anatomical position of the right hip bone. I have to hold it with the same hand with the bone. Please tell the word right hip bone. Coronal plane. This is sagittal plane. Okay, sagittal plane, and this is coronal plane. Okay, so coronal plane. So this is the hip bone. You have understood it, what type of bone it is, how to determine the side determination, and how to hold it in anatomical position. Next we will go to the femur. So let's start with the femur. Okay, the femur has a typical long bone, has 3 ends, the upper end, shaft, and the lower end. The upper end will be directed upwards and the lower will be directed downwards. The head will be directed medially, and the posterior, this linea aspera, will be directed back posteriorly. Okay, so for the anatomical position, just put the index finger on the below the head, and it will let the bone be steady, and then hold the bone with the right hand. So this is the anatomical position of the femur. Okay, so just remember this point, this linea aspera. Okay, upper and lower end everybody remembers. Linea aspera, so what forgot during the exam, tension is another thing. Okay, just remember the linea aspera. So this is the anatomical position of the right femur. See, upper end and lower end everyone remembers, just the linea aspera nobody remembers. So you should do the linea aspera. Okay, please tell the linea aspera, or else you are doomed. Let's talk about the tibia. Tibia is also a long bone. Okay, you can see upper part, upper end, shaft, and lower end. Okay, in the upper end you will see the tibial tuberosity. This should be directed anteriorly. This condyles, you can see medial and lateral condyles. Okay, they will be directed upwards. Okay, and this you can see the lower constricted end, it will be directed downwards. and the medial malleolus will be directed medially as usual. Okay, so to hold the bone in anatomical position, it is already in my anatomical position bone. Okay, so I will show you nicely. So medially, this anterior vertebrosity anteriorly. So this is the anatomical position of tibia, of actually left tibia. Please mention left femoris. Okay, one of tendon of quadriceps femoris. This bone, this sesamoid bone, patella, which is the largest sesamoid bone. Okay, this is form. It is also known as the kneecap. Okay, and it has apex. Okay, and a broad base. Okay, the base, as you can see, the base is also known as the superior border. Okay, some books say it is superior border. Okay, the base is, as you can see, the base, as I said, will be directed upward and the apex will be directed downwards. For knowing the anatomical position, no one will remember the points of the anatomical position. Just say it that this articular surface. See, there are so many articular surfaces here. Okay, these are all articular surfaces. This will be directed posteriorly, and this is rough surface. This will be directed anteriorly. Okay, just say this point. Put this in your hand. Okay, see, this is directed right and this is going rightwards. Okay, as you see from my hand, the left one I in this video only I have shown it for more clarity. This is going to the right, so this is the right patella. Okay, this is the anatomical position of the right patella. Please tell the right. Okay, just for clarity I will show you the left patella also. See, this is the left patella. Okay, so this is having the upper, as I told, the upper flat tendon, and this is the narrow pointed tip. Put it in your left hand and you will see just how it bulges towards the left. Okay, you can see it like that. So you have to hold it from the left, and this is the left patella. Okay, so for the scientific determination and anatomical position of the fibula is also known as perona because it is arrow shaped. Okay, just like arrow, as you can see. Okay, the fibula consists of three parts. Okay, this is the upper end. You can see the styloid process just there. Okay, styloid process. This is the fibula upper end, consists of a constricted neck, and it consists of shaft, and there's a lower end. Fibula, like any other long bone, has all the three parts. Okay, any long bone, just don't miss these three parts before telling, or you are doomed. Okay, the lower end, because it is not easy quite for many to determine the side of fibula. Okay, for the lower end I have some tricks. Okay, we will see this tiny depression. Okay, and this articular surface, you can see articular surface. I have written T also here. This articular surface is for talus, for the ankle joint. This fossa, okay, this depression we call this fossa, malleolar fossa. You have to take the thumb finger, okay, thumb, put it here, this articular surface here, as it is left bone, so I have to hold it by left bone. Okay, and also one important point is that this lateral malleolus is there. The lateral malleolus, as you can see, it will be directed laterally. Okay, so this fossa, you have to just put your thumb here and then take the index finger and hold it like this. Okay, so this is the anatomical position of the left fibula. So for the upper limb, we will be starting with the simplest bone in our anatomy, clavicle. Most students prefer this bone. Okay, so it is a long bone. Okay, it is a modified long bone. This of some part. This is the medial end. This is quadrilateral. Okay, you can see this is quadrilateral. Okay, this is the lateral end. This is triangular. Okay, this is flattened from side to side, and this is a shaft in between. As it is a long bone, it consists of three parts. Okay, the anatomical position, there are some tricks. Okay, see this bone, quadrilateral part will be directed medially. This lateral part will be directed laterally. Already the side determination is done. It is right. It is right clavicle. Okay, just one thing is left. See if you for the superior and inferior surface. Okay, the superior inferior surface, from see just from the lateral to 1/3 and medial 2/3 downwards. Okay, see there will be a groove. Okay, it is marked in blue also little bit. This is a groove. Okay, this is here is the attachment of the subclavius. Okay, this is a subclavian groove. This groove will be directed inferiorly, not superiorly. So the smooth part, which you can see, this smooth part. Okay, this smooth part will be directed upward and should be in front of your eyes. Okay, So do not miss this point. Okay, also remember one point, the medial end will be directed little bit downwards than the lateral. Okay, so this is the perfect anatomical position of the clavicle. Okay, so now we'll start with the scapula. The scapula consists of the scapula is a flat bone. Okay, we'll be starting on the scapula. This consists of superior angle, inferior angle, and the lateral angle. It consists of the superior border. Okay, the lateral border, which is the thickest, thickness of this, and this is the medial border. See the thickness of this, very much difference in the size. Okay, this is the borders and angles. Okay, and it consists of three processes. Okay, acromion process, this is the coracoid process, and this is the spinous process. Okay, the spinous process divides the convex dorsal surface into two parts, supraspinous fossa and infraspinous fossa, and the concave costal surface, which is facing the thoracic cavity. Okay, therefore it is convex. Okay, you can see the convexity in this video also. Okay, so now let's put this in side determination. So first we will inferior angle should be directed downwards, lateral angle or the glenoid cavity should be directed laterally. Okay, the coracoid process should be directed forwards. Okay, this should be the rule. Coracoid process will order be forwards and the glenoid cavity will be laterally. Okay, if you don't do this also, this upward, this glenoid cavity will be little bit upward, then also it is okay. But you should never miss this convex surface facing in the anteriorly, the convex surface facing posteriorly, this glenoid cavity in the laterally, and this acromion process in the front. You should never miss this points. Okay, you should never miss which point. So this is the anatomical position of the right scapula. Okay, now let's move to the humerus. So now this is the humerus. This is also a long bone, and it consists of three parts: the upper end, shaft, the lower end. Okay, upper end, as you can see, it has a globular head, and the lower end has these parts. Okay, first of all, we have to see some points. Okay, this humerus, first of all, we have to see that this head, this medial head, will be directed. This globular head will be directed medially. Okay, you can see this lesser tubercle, intertubercular sulcus, and the greater tubercle, it will be directed anteriorly. Okay, the olecranon fossa, you can see this are the olecranon fossa. Okay, here the olecranon head will be there. Okay, this is the olecranon process. This is the ulna. Okay, this is ulna articulates with the humerus idea, and they puts a hand in the olecranon fossa. So this is the anatomical position of the left humerus. Okay, you can see this is the left humerus, and holding this with the left hand. Okay. So let's start with the radius. The radius, it consists of the three parts. It is a long bone. As you know, it consists of the upper end, which is disc-like. Okay, constricted neck. Then we have the shaft, and then we have the lower end. Okay, for radius you need to know some points. Okay, this like the head be directed upward. There you can see in the shaft there is a border known as the interosseous border. You can see how sharp it is. Okay, I can put it on my hand, I can feel it with my hand. Okay, so this will be directed medially. This is the styloid process of the radius, will be directed laterally. Okay, and you can see here, I can show you here, this is the listus tubercle. Okay, this is a listus tubercle. You can see the tubercle. Okay, a listus tubercle. This tubercle, you see, this will be placed dorsally. Okay, this will be placed dorsally. So this is the this radial tuberosity also, it will be a point for you. The radial tuberosity will show you it is medially. Okay, it will be present medially. So this is the anatomical position of the left radius. Okay, in the points are the disc-like head will be directed upward, the radial tuberosity and the interosseous border will be directed medially, listus tubercle will be presented dorsally, and the styloid process will be directed laterally. A long bone, typical long bone presenting of the upper end, lower end, and the intervening shaft. Okay, it consists of a just like radius, it consists of a thick border. Actually radius and ulna are fused like this. Okay, it's not fused, they are making a joint, three joints. Okay, here I will tell you later. So these joints are there. Okay, so there, this is the sharp crest like border known as the interosseous border. Okay, it is present like this, it will be present laterally. Okay, as you can see, this will be present laterally, and radius will be like this, present medially. Okay, styloid process of this, see, the styloid process of this ulna will be present this will be present medially. Okay, so this sharp interosseous border will be present laterally, This styler process will be present medially. I will show you the introosseous border nicely. Okay, you can see it nicely. Okay, so and this hook-like process, you say here it is the olecranon process, here is the coronoid process. Okay, this is presenting upwards. Okay, so this hook-like end will be presented upwards. Okay, wrong hand. Okay, you can see, and left. This is the left. Actually, this is left turn now. Okay, so this hook-like process will be presented upward. The introosseous border will be presented laterally. The styler tubercle will be present. The styler process will be present medially. So this is the anatomical position of left arm. Okay. So all the bones of the first prof for the appendicular skeleton, anatomical position and side determination of done. Thank you for this video. Do like and subscribe this video. Thank you.